National Library of Medicine, more than 26,000 Americans die each year because of lack of health insurance. How many citizens will we allow to die before we advocate for serious change in the healthcare system? These 26,000 people are mothers, fathers, brothers, and sisters who deserve to live and the right to healthcare. The problems that come along with no healthcare or unaffordable healthcare include unaffordable treatment and poor health. We could solve these problems by implementing a universal healthcare system to ensure everyone has access to healthcare without worrying about financial aspects. With the universal healthcare system, we would live in a happier and healthier society. First, problems associated with lack of health insurance, like I said, include unaffordable healthcare and poor health. And when those who have no health insurance feel unwell, they often avoid going to the doctor because of high costs associated with uninsured medical treatment. According to Manhattan MRI, on average, MRIs in the US can cost between $400,000 and $12,000. MRIs are machines commonly used in the diagnosis and investigation of many health concerns. With this price, the uninsured steer clear of any professional medical treatment, allowing illness to worsen and potentially spread. Not going to the doctor allows for illness to progress. Because many people ignore health concerns out of fear of cost, they do not receive treatment for serious, long-term, and chronic illnesses like heart disease and cancer. This lack of medical attention leads to rapid progression and a serious risk of premature death, which in many cases could have been cured or treated to a manageable state with proper health care. Other countries have had great success with the universal healthcare system. Switzerland's universal healthcare system is built on an ideal called social solidarity, which, according to the National Institutes of Health, is an important foundation of equitable healthcare systems whereby everyone is willing to pay for healthcare according to their means and everyone benefits according to their means. This system has increased the country's life expectancy and contributed to the overall health and happiness of its citizens. Now it's America's turn to implement this system for its citizens. The ACP Journal Annuals of Internal Medicine states in an article titled "Envisioning a Better U.S. Healthcare System for All" that an estimated 80% of an individual's health is tied to socioeconomic factors, physical environment, and health behaviors. Universal healthcare would free citizens of their predetermined circumstances and give them the right to live a life not burdened by the cost of necessary medical care. Upon implementation of a universal healthcare system, we would be a healthier nation mentally and physically. Americans would not have to avoid medical attention because of its unaffordability. The 26,000 Americans who die annually from lack of health insurance would receive treatment and the opportunity to live their life pain-free. Healthcare would also strengthen our nation through the value of social solidarity. Social solidarity would cause us to realize that it's our job as humans to look out for each other and a society with compassion and dependence to a degree on each other. On one another would unite us in various aspects. With this being said, healthcare is a right and all citizens deserve to live a healthy life with access to the medical care they need regardless of socioeconomic status. Those 26,000 Americans had families, friends, and lives that deserve to be lived to the fullest. If action is not taken soon, this number will only increase. The rights to life, liberty, and the pursuit of happiness cannot be achieved without allowing citizens to live a life free of mostly avoidable medical burdens.